Medicine was and it still is a very noble profession. And one of the most respected professions is the profession of a medical practitioner. The authors, the principal authors of this book, which is Dear People, which is being, which will be out soon. When I was approached by the principal authors of this book, I was really, it really touched me because now, as you see, there's a lot of speculation amongst patients that doctors have they have a lot of self-interest in which vested interest, and the medical profession has become more of a business rather than a noble profession. So I was very touched by this very fact that there is a book that's been written by a couple of very well known medical professionals who are stalwarts in their own right in their field of medicine, who are sharing some of their very close to their heart experiences in this book. So this book is basically related to the relationship between doctors and their patients, which covers a lot of aspects of the profession of medicine, which may not be very well known to the layperson. These are stories which really touched the heart of doctors. They will also touch the hearts of millions of people who read this book, and they are practical life experiences which we face in our day-to-day medical practice, and how there are circumstances and there are instances which affect us as well as patients, how the interaction between doctors and the patients affect each other. So I was told to mention some instances in which I faced in my career, which I would like everyone to know about, which would send across a hopeful and a warm message to all the readers, all the doctors who read this, all the people out there who read this, and send a sweet message across, or send a very practical message across to millions who read this book. So what I'm as a dermatologist, I practice general dermatology as well as cosmetic dermatology for the last 15 to 20 years that I've been in this profession. There are so many things that we come across in our daily practice, wherein patients come with some expectations and then the doctor is tries to fulfill them, but sometimes we have to refuse patients, keeping their best interests in mind. There are instances where there is a lot of compulsion. There could be a lot of expectation across from patients, which we are not able to fulfill, which gives us also a sad state of mind. But I think somewhere the line needs to be drawn, and we need to explain to patients that this is not right for them and what they're expecting is not right or it's not achievable. So the stories which I have mentioned in the chapter that I have written in this book, it mentions two very close instances, very close to my heart. Especially as a cosmetic dermatology practitioner, wherein there is one patient who had come in with pigmentation, who wants skin brightening or skin lightening as they call, which is like in vogue these days. I mean, youngsters who being blessed with really good skin, but they are with dark skin. Nevertheless, even though they have a very healthy, beautiful looking skin, they want to get fairer. That's a very worrying trend that's there nowadays in today's society. So there's something which I mentioned about that, and how the doctor sometimes needs to put their foot down about some things which they feel is not going to benefit the patient, and how the doctor's advice being helpful to the patient in the long run. The other instance is with a patient with severe acne scarring, and she was really suffering really badly, and how the doctor, meaning myself as the treating physician, have brought the patient out of severe mental and physical trauma and emerged victorious. and how this has changed the life of the patient. So there are different methods in which doctors can change the life of patients, either by refusing a particular treatment, knowing that this will harm the patient, and or by helping the patient do a certain treatment with their expertise and get out of a really troublesome disease or a situation. So these are the two scenarios wherein the doctor has put in their mental energies and their understanding of the subject to bring out change in the life of patients. So I think this is something which all doctors face in their day-to-day practice, and we do try our best, to the best of our ability, to help the patient come out of their traumatic conditions. So I am sure this chapter would it would touch the hearts of a lot of people, and they would understand more deeply the relationship between a doctor and their patient, and how the matrices work, so that this relationship goes to a fruitful end. Thank you so much.